Good evening and welcome to Nivarana's Public Health Forum. So, for those of you who are hearing about Nivarana for the first time, Nivarana is a public health information and advocacy platform that was started in 2022. So, we aim to bridge the gap between the public and public health by making complex information accessible and easy to understand. So, we wish to empower people with the right information with the hope that more people would begin to be bothered about the public health practices in our country, understand what is lacking, and ultimately demand things to change. Public Health Forum is one of our initiatives where we have solution oriented discussions of problems with experts in a panel and then show it to an audience. So, I'm Christianis. I'm the deputy editor of Nivarna. In my day job, I'm an internal medicine physician and a freelance health journalist. And I'm extremely happy to invite you all to a crucial conversation about disability and the social health of people with disabilities. Now, before we begin, let me introduce our amazing speakers. Um, our first speaker is Dr. Pratiksha Sharma. She is the founder of Brightside Family Counseling Center, and she understands mental health at close quarters. At present, she's a psychotherapist, a musicologist, and a researcher. She has dedicated her life to understanding and addressing the complexities of mental health by interweaving knowledge from various disciplines, including psychiatry, social psychology, sociology, law, anthropology, linguistics, and performing arts. As the founder of Brightside Family Counseling Center, she is creating an organization where people, whether they be employees or clients, are nurtured towards becoming their best selves. Our second speaker is Abhishek Anika. He is a writer, poet, performer, and actor based in Patna. He authored The Grammar of My Body, a memoir on living with locomotor disability and chronic illness. He uses personal narratives to advocate for disability rights across various mediums. And he founded Dislang, a magazine for disabled voices. And he also mentors at Beyond Ability, a spoken word artist. He has performed over 50 times in India and beyond. And he holds degrees from Delhi University, TIS Mumbai, and Ambedkar University. Smita Sadasivan is an accessibility and inclusion advocate. Can you show your video, please? Um, she is also a disability rights trainer and policy expert. Living with multiple sclerosis for over 2 decades, she works at state, national, and international levels on disability policy, health equity, and accessible elections. So she serves on multiple government advisory boards. She leads research on inclusive healthcare and she consults for global platforms like World Health Summit and UHC 2030. She is the recipient of Shresh Divyangan National Award and Tamil Nadu's Best Social Worker Award. I also forgot to mention that Abhishek's book won the Rainbow Awards and is currently what I'm reading. It's great. So now that I have introduced all the speakers, we'll just go around and I would like to start asking questions. So basically, today's forum, what we have decided to talk about is an oft ignored aspect of disability and disability health, which is social health. Um, the access to places of leisure, access to leisures, relationships, social connections, and pleasure for people with disabilities is not something that we often discuss about, which is what we want to bring to the forefront and have a conversation. What we hope is that after listening to what our three amazing speakers have to say about this, that we drive people to think more along these lines and hopefully do more work, um, which brings this invisibilized aspect to the visible platforms. So, my first question is to Pratiksha ma'am. And my question is so, how important is human connection for any person's overall well being? When we talk about health, we talk a lot along the physical and mental lines, but I want to know whether human connection and how important is it for a person's well-being?
Thank you, Christian, first of all, for putting this whole thing together, and then such an array of speakers, and your all effort in doing so much of work. Thank you so much. I would like to say that we become human and we recognize our humanity primarily in relationships. The two most important things which any human needs is relationships, because we are all relational in our disposition. We thrive in relationships. And the other thing we all require is meaningful work, commensurate with our capacities. And that these are the two bulwarks within which our life can be defined, and we accomplish a sense of well-being and goodness and so forth. Now, what happens is, with the people who are disabled, uh, they are mostly seen through a medical lens, and their whole life actually comes to focus around very few things, which is primarily their family relationships. And they have very, very less social connections, which is very, very unfortunate, because I can say that from personal experience. And it's not so easy, Christian, because you didn't mention the fact that I have lived with mental health issues for the longest, and keep recovering from them time and again. And so I understand mental health and disability very, very closely indeed. And as a result, the way I've seen people, when the entire burden of relationships and caregiving falls on the same people. So the people have very limited people that they can fall back on, especially with mental health issues, especially with any kind of disability. I'm just thinking of, I just want to just bring in one story, one young person's example, because she was not a person having technically that sense of mental health issue. It was spectrum, and she was a very nice girl. I was just in counseling for her for a very brief time, and she had, by dint of labor and hard work, done a master's degree in something, and she had a job when I was talking to her. And the job was such that she was given the freedom to work both from her home, and she could go to office if she wanted to. So I would ask her that, why is it that you're not going to office? It's so much nicer that you could meet with somebody and interact with people and have actual day-to-day connections with people. But she says, even if I go there, nobody talks to me, because she had a little, a slur in her speech or something, uh, some kind of what would be seen as a deficit in expression, and as a result, people find it very convenient to leave her out, leave her or anybody of that kind out, and so when you say visible or invisible disability or any kind of disability, it's very easy for people who are not disabled to further disable people who are trying to, who have somehow enabled themselves and reached the mainstream. And that is a very, very difficult barrier to overcome, because as it is, people who are disabled because society is also contributing in a very, very significant way to that disabling. They are not, nobody, see, suppose I'm born in a certain way, I will accept myself and do what I can with whatever I have. But if you, by way of how you include me in your connections, your relationships, your association with me, or whatever it is, if you don't include me, I can't push myself beyond a certain point. So if this young person goes to office to sort of communicate, and she hopes that she would be included in the discussions, and somebody will sit with her and have lunch or tea, or someone say hi to her, but no one does that. So how does the person feel? So they come back home much more dejected, because they have taken the trouble to go all the way, and yet they come back as distant and as aloof from anybody as they started out, and that is quite heartbreaking. So eventually, this home, which started as a kind of a convenience thing during the COVID thing, was actually became a refuge for people, because they refused to leave the home, and it was such a disaster, because more and more people are getting isolated, and that really, and so everybody basically needs connection, everybody needs acceptance by others, no matter how they are, no matter who is, however. We all just want that recognition that I matter, that I matter to you, and you can say hello to me, and it doesn't I don't take away anything from you just by that hello of that you offer to me. So that is something which we really have to sensitize people about, everybody, that why mattering matters, why people mattering to each other is so important. And for people with any kind of disability, the first thing about disability is it is stigmatizing to ourselves. We feel the stigma more than anybody. Before you stigmatize me, I will feel that, oh my God, I wonder how this person is looking at me. Because I'm accustomed to a certain gaze of society. And that gaze has already percolated my being to such an extent that I don't have the capacity to overcome it. So only by kindness and with inclusion, with some humanity from others, we can actually come out and step out of our wounded, very, very wounded selves, and then say, yeah, maybe I can, somebody can see me beyond my dis my disabled identity, and see the human that hides there and there. So human beings thrive in relationship, and everyone needs that relationship. So looking at people through the lens of disability is actually is foolish and ignorant of society. Nothing, I won't say anything more than that at this juncture, because it's just pure ignorance. That's all, to reduce people to their disability.
And something that is brilliant that you brought up is that more than people having disabilities, it's more about how society disables people by not including them and by not providing access at various levels. So
Mm.
that's a very important narrative shift that I think I have learned from listening to you speak here, as well as the other times that I have engaged with your work. Um, so my next question would be to Smita. Um, Smita had worked with the government to make Marina Beach accessible to people with disabilities. So, as and it's revolutionary because it's a space of leisure, not like something that other people deem necessary, like education or healthcare areas. It's a space of leisure which was made accessible. So, I wanted to ask you, what are the difficulties that people with disabilities face when accessing spaces of leisure, and what are the narratives surrounding that?
Yeah, thank you so much, Christianis. So yes, so there are a lot of barriers, whether it is environmental or information related or communication related, and also there are barriers in the technology, in the products, facilities, and services as such. When we look at leisure activities, then there is also this ableist mindset that is coming in, like Pratiksha was mentioning. We can actually term the ableist mindset into two. Like, one is, as you said, this is not a priority for you. Why do you think about leisure or going to a beach when you need education and employment? That is the most important thing for you. So that kind of an ableistic mindset is one. And the other indirect mindset is like, oh, so sad, why should you come out, why should you trouble yourself to come to a beach, or why should you trouble yourself to come out asking for these things? You can be at home, we would like to help you. And so this is most dangerous. And when you look at the ableistic attitude as well, what people fail to understand is that accessibility is required for everyone, and it is not only for people with disabilities or people with any reduced mobility. And example, if you look at a two-storied building, and if there is no access in the form of stairs, so how will a person without disability, a healthy person, go up the two-story building? He can't jump or fly, right? So you need some access. You have built it as stairs, whereas it is not accessible for other persons who have reduced mobility. So what we are asking, or what the law is talking about internationally, is to look at universal design. When we look at universal design, like a ramp, for example, where a person with reduced mobility can also go up, a person using wheelchair can also go up, move up, and also a person without disability, a person who is healthy, or a person who is elderly, or a child, or a person who is carrying a heavy weight. So going for universal design. So that is the legal mandate also, and that is the perspective towards which the human rights movement is moving forward. And so from the aspect of looking at people, a marginalized group, as beneficiaries of charity, look at as equal, people with equal human rights, as everybody are entitled to all fundamental freedoms on an equal basis with others. So in this aspect, if we look at leisure is a place where it promotes a lot of mental health, socialization, and it boosts your energy. Take for example the beach. Yeah, the breeze, the sand, the waters, everything is so energizing, and it calms down yourself. The people are all the time having a lot of issues, like anybody for that matter, a person with disability or without disability, have a lot of turmoils. And when you go to some leisure spots, or when you socialize, and when you get into an accessible environment, accessibility also means safe, isn't it? So when we feel that we are in a safe space, then that itself boosts ourselves. Okay, I have enough support that I need, and I don't have to worry about anything else. So this kind of an energy is gained in an accessible environment, which many people who are not disabled and people in the administration fail to understand, and that itself is a major barrier, apart from the barriers of information communication and environmental barriers.
Thank you so much for pointing out that the current levels of access are, and the way we ask for access for people with disabilities will also make access good for so many people, like older people and, people carrying weights, all of those things that you had mentioned. I'm so amused that a lot of places are built inaccessible to a lot of populations, not just,
Yeah.
and that is also something people need to think about. Yeah. My next question would be to Abhishek, and this is on the topic of pleasure. I want to ask you, why is the sexual health of people with disabilities not often discussed? And is there a desexualization of individuals with disabilities happening in the conversation?
Well, I think there is a lot of desexualization by the society, but more importantly, there is also a lot of desexualization by disabled people themselves, because there is a certain vocabulary when it's about sexual health, sexual desire. Disabled people have been trained to be very ashamed about their sexual desires by the society. So when they talk about sexual desire, they actually talk about either love, if there is, they are trained in the Bollywoodish language of love, very Bollywoodish actually, or they talk about marriage. So I'm writing a piece right now, and for that I was looking at what people post in Facebook marriage groups, handicapped groups they are called, and it's mostly, while we say that percentage medicalization doesn't matter and all of this doesn't matter, people actually use medical certificates as the basis of matchmaking, and like I have only 40% disability, so I get the perks, but I'm not that disabled, or I have 60%, so I specify all the percentages of the disability. But when you dive deeply, most of them want sexually healthy relationships, and that is the main purpose of marriage. And but there's the word which never appears is sex, because
Yes.
people are very ashamed of using that word. There is immense social shame associated with the idea that a disabled body, or even in our Instagram age, an ugly body being expressing desire, you know, is often shamed, and shamed a lot. And a so-called not normal body, you know, is also shamed for even enjoying, even dancing. There are friends from the disabled community. There is bad boy or dance on wheels who does bhangra on wheelchair, and the kind of wild comments he gets every time he posts, because people can just unfollow him, but people hate the idea that that person, disabled person, is dancing and acting happy, performing some form of happiness. So I think there is a huge problem, and that's why people are afraid to express that they're actually people with desires. And in today's world, everyone wants to be desired. Desired, being desired is the thing for everyone. Able-bodied, disabled, it doesn't matter. Like across everyone. So disabled people also want to be like that, but the problem is, if they express, they are very vulnerable to abuse if they express their desires. But also, once they go out, from the basic accessibility things are, of course, there, that the websites are not, apps are not accessible, things are not. But just going out on a date, imagine a disabled person going on a date. They have to plan 500 things in their head. And if the person they are going out on a date with is not a disabled person, they might not think about these things, like where they are going to a date, what they are eating, what they're drinking, uh, at what time they are meeting, what is the weather outside, what is what is the toilet situation nearby, what is, like, there's thousands of questions which a disabled person has to decide before going out anywhere. And especially when going out on a date, they have to think about appearance, things like that become very important, but they're also their basic accessible needs becomes very important. So it's a very difficult situation. There is alienation, because I think that leads to a form of alienation which is particularly haunting, because society is generally indifferent anyways to disabled people. So I don't expect everyone to be, to treat disabled people in a fair way, because they don't care. They haven't seen a disabled person ever. But what disabled people want, or what anyone wants, is actually you have some few people around you who are actually part of your life. And some disability activists called it the pea in a pod kind of thing. Like every pea has few pods, so you find your own pod. And so the whole pod system is makes sense. But with as you grow older as disabled person, those pods also begin to alienate you, because if they are from different forms of life, they are living different kinds of life, they have different responsibilities. One of Professor Anita Gai used to say that as you grow older, your friends ditch you when you are disabled. And I used to say, maybe she is just a bitter old woman. And I told her, why are you so bitter? And she said, you will understand. And the more I get older, the more I understand, because it's not only about accessibility. Accessibility is the very superficial thing, that my house is not accessible, so I will not call you. But it's also about heteronormative. I have a heteronormative but family. I have a wife, kids. uh, if I have to socialize with people, why would I socialize with a single 35, 36-year old man, and vice versa, or whatever. So that is one of the biggest factors which comes across, because you don't fit into the normative ideals of society. And that, coupled with the idea that you can't find yourself uh, either expressing desire, or either receiving being at the receiving end of someone's desire, makes life very difficult for you, because then all your life is limited to your parents and caregivers. That's it. But as you grow older, that is also, that goes out of the picture. So it's a very alienating thing overall. And with regards to sexual health, it becomes even more difficult, because You get older, you are lonelier, you don't have company, you know, and it is just not good for your overall health. So yeah, I think that is one of the crux of the problem. I think even friendships, are denied uh, when it comes to disabled people, because it's just that they don't fit into the normative selves. And of course, sexuality, then people will have perceptions. I don't judge people, able-bodied people, for having those perceptions. It's just that the able-bodied people don't accept that they have these biases. That is the biggest problem I have with the world. That it would be better if they actually acknowledge that they are maybe not attracted to disabled people, that they are maybe find themselves pitying disabled people whenever they see disabled people. So, or they don't find that they match with disabled people in any sense, even in terms of friendships. So they have to, if they acknowledge that, it would be much better for us, because it would be a closure, form of closure for us. Yeah.
So, Indian culture anyway associates a lot of shame with sex, and then you have added nuances about how people with disabilities relate to sex. Thanks for that. And the other thing that I got away from what you said is that how society would like to put a person into a box, and then they expect that person to act in a certain way, and how even expressing happiness or joy or um pleasure in from being from that identity to the society. Thank you so much for bringing that out as well. My next question is to Pratiksha ma'am. I want to know how well does healthcare or healthcare professionals address this aspect of health, or is it, do they even recognize that this is a part of health, or what perspectives are missing from the conversation in terms of social health? Ma'am, you're muted.
Abhishek has said something quite important about the desexualization of the disabled individual, and how they are made scapegoats, and they're just seen in some kind of a caricature of people, of life, that, oh, this person is disabled, why would you? So the fact that we are lacking connections, and healthcare professionals, see, mostly healthcare professionals are looking at people through the medical paradigm, that these people need medical care, and that is all that they need, so if you take care of them via this therapy, that medicine, this or whatever it is, couple of things, that is all that there is to their life. And now the rest is that they should go back home and just live their life peacefully, because everything is taken care of. And then they say, okay, you go and meet your friends sometimes, could do something of that. But they don't realize that to live a whole kind of a life, and they don't need that governance by the healthcare professional and the parents also, I mean, or the caregivers, whoever they are, by the parents or married partners or whatever, children. So they I think this is something which is quite underplayed. And Smita has said also very important thing about access. And people don't have access, or they always need someone to go with them. That itself is a barrier to access, so there's a dual entanglement with the caregivers, because at time, and suppose you're not able to access things on your own. Everybody is not equally mobile, or let's say equally able to navigate spaces and stuff. In that case, you are there, and you need someone to take you somewhere. And that itself, so I don't think I am not sure healthcare professionals are very much thinking beyond their own input into that person's life, that, okay, I need to, they're just thinking, okay, this is another patient I have to deal with, this person, this illness, or currently they're dealing with whatever situation. And social health, they just say perfunctorily, okay, do this, do that, whatever. But I don't think this is visible very, very well, or very clearly in a lot of people's recommendation to their patients, right? We're looking at professionals making recommendations. So it's not done with a lot of concern for what actually they have access to or whether they have any access. And a lot of times in working within disability circles, they have access to more of their own kind only. So that is the only access that they have. A group having people having mental health issues, they come together. The rest, they have no access to anybody who's so-called normal or more regular, more not so, not so disabled, like, and so there is very actually limited access, because in that access, whatever little you have, the scope for interaction else, understanding their perspective and looking into their world with a little more compassion and empathy is really not there. I think Abhishek has also pointed out something very important about the lack of friendships and the fact that as you grow older, the needs also get more complex. Sometimes the needs get complex, sometimes friendships wither away, who were there, people who were sympathetic or let's say more compassionate in younger years. As they move on in life, their whole their relationships also dwindle away. And so these are, as you grow older, very real concerns. And I'm not sure I've seen too much of sympathy, or I mean among from doctors also, for anybody as such, because they are just there to govern the medical part, or to govern, or to show them the way that this is your medicine, do this thing, have this thing, this is what you have to do. So it's very directive. The approach is very leader oriented, that I'm showing you the way, and this is what you have to do. Yeah, Krishnas.
So the treating team or whatever it is has this very paternalistic kind of approach, you say, with the doctor taking on the role of a leader and then just laying down a pathway for the treatment to go without being collaborative about it.
There's no collaboration at all.
So what about mental health professionals? Are they faring in any way better in addressing these things, or are they just like doctors?
Now, which ones are you talking of? The non-medical mental health?
Non-medical mental health professionals.
See, if you look at by and large, the understandings are still governed by that normativity, which comes from the DSM, which is like that there is an actual mental illness, and mental illness needs medical intervention because that is the only way out. Whereas half the problems can be solved if people had, social connections, and other people could hear them out. People of their own age, peer group, this and that. They could be more included. There would be more equity, and I don't think mostly what I'm seeing is, first of all, in India, people are talking from a lot of common sense in counseling professions. So they are also led by the DSM approach, which is the diagnostic approach, which is that there is an actual mental illness out there. And they are, again, coming from that attitude that, okay, there is an organic problem, let's solve the problem, and the rest, everything is taken care of, but you keep taking medicine. So when you keep a person confined to their patient role, what happens is you reinforce within them that there is an actual problem, which may actually have been due to their, their traumas and their family problems, or their childhood, what do you say, childhood adverse events and stuff, something like that. So all kinds of things can lead to mental health issues. And people with disability are, as it is, so ostracized that the stigma of the disability, which everybody has internalized stigma to a great extent, and I'm not sure I've come across many professionals with who one can overcome the stigma easily, who are going to look at you beyond your disabled self and look at the self itself, and not just the, or some other self they'll focus on. It's always the medicalized disabled being that they're addressing. And they are in a position of some kind of, epistemic, or let's say social power. They have the control, and they have the capacity to guide another person. I'm not sure I've seen too many collaborative people, not yet, at least. Or very few, if at all, I can say that. So the non-medical professionals are not really helping much, at least. So I don't know if I personally not dealt with anybody who practices art therapy. Maybe they are doing that because this is a new thing lately, which is happening, and a lot of people are practicing other kinds of things also. Maybe the peers are doing something different, if there is, like, because I am doing something different, I know for sure. I know there are other people doing some peer work also, that could be the beyond the medical model. But if we see the professionals, by and large, if there are only two kinds of people who are looking at the medical paradigm and who are not looking at the merit. So the not looking at the medical framework also sometimes tend to go under the medical thing and say, oh yeah, you have a problem, no, so just do this thing. But I think it'll take a bit of, or maybe I don't know, bit or how, but kind of a bit, or maybe a long bit of effort from people to challenge the medical framework and say that no, this is not the only thing and it's not really working. Governing people and keeping them as subjects of medicine can play some role in the short term, but in the long run you have to rehabilitate, and rehabilitation essentially requires reintegration back into society via meaningful relationships of all kinds, not just medicine dependent relationships, but all kinds of friendships, all kinds of accesses, all kinds of enablements, which currently I don't think society is showing any readiness for. I don't find that, at least.
Thank you so much for that perspective of how the medical model overtakes um, the,
Becomes
all
hegemonic.
the other important non-medical aspects of rehabilitation. And I also feel like when we talk about rehabilitation, also people really do not consider reintegration into society um, as an individual with social relationships and employment and a career and all of those things as well, the way you have pointed out. Um, so thank you so much for mentioning that. Now I will move on to Smita to talk a little bit more about spaces of leisure. So when you had this conversation with the government to make Marina Beach accessible, what did you realize about um, the barriers, or why isn't it a priority for them?
Yeah. Yeah. So again, I am picking up from what Pratiksha said. It is whose priority? Like, as a person with disability, as a human being, it is my priority. Whereas from the administrative setup, or from an ableistic mindset, or from a different group which doesn't have this particular requirement, or yes, leisure is everybody's requirement, but who doesn't require a universal design or whatever, then their priority is like they are deciding our priority. So that is basically an issue. Who are you to decide somebody else's priority? So if we are talking about spaces, then it should be equal for all. It is a priority for everyone. Take people on board, all the marginalized groups on board, and discuss. Rather, just a group of people sitting and deciding on one person's priority is the issue, in the first place. And like Pratiksha said rightly, the disability movement moved from the medical model, and what we were questioning and what we were actually demanding is just stop treating my ills, teach me skills. So don't keep looking at my body, correcting my body, rather teach me skills, or rather do what I want or what I think as priority, so that I can also have a level playing field. I can also have an equal space like you do. And my enjoyment, my experience, my contribution to the society, it need not be like I am a person to whom somebody else will be contributing. I have an equal ability to contribute, where it needs to be accessible, where it needs to be recognized, and it needs to provide me the space so that I can also contribute. I can also be as a person as you are, right? And so that is where the priority is stuck in these aspects. And when you look at the beach accessibility, what we understood is like when the beach was made beaches for everyone. And you look at the facilities for people without disabilities in general population, you see the lifeguards, you see the ATVs which clean and which also monitor the beach. You also see, shops where people can access, and there are public toilets where people can, use when they need. So there are these amenities around a leisure spot, which is again not accessible. When we started working with the authorities, the Greater Chennai Corporation, we mentioned that it is not only essential to make a path till the waters, but it is also essential to make all the other amenities accessible. Like we need an accessible toilet, we need an accessible, um, uh, you know, um, uh, um, beach wheelchair which goes into the waters, because when people can touch the waters with their feet or can just dive into the water, why can't we have that same experience? So we need balloon wheelchairs which floats in the water. And we also need lifeguards, we also need the life jackets which needs to be stored in the container. We need a set of wheelchairs which need to be stored in the container, so that when a person comes without a wheelchair, or when a person needs a wheelchair, there they can just take that out, and a person to support. So all these support systems also we worked out based on the support systems available for others, for the general population. And so all the, when you look at one priority as the as a leisure accessibility, on which there are multiple other priorities which is just taken for granted by everybody else, and they don't even recognize or they don't even acknowledge that they are using those services, and they are having those priorities. When it is the discussion falls on the services for persons with disabilities, then the question of, do you need this, should we provide this, or is it necessary, is it important for the group itself, for persons with disabilities itself? So all these kinds of questions on priority comes up, which we literally, we could actually make them understand. And the authorities were very well compassionate, very well understandable, and they worked together with us. And in this process, we not only worked with the authorities, we worked with the other stakeholders, like the vendors in the beach, or the fishermen community, the environmentalists, and the local residents, and different other people. And we also worked with the environmental department, the Greater Chennai Corporation, the tourist department. So different departments and different stakeholders we worked with, and we could gain knowledge. And that is what is lacking when government is doing some scheme or some service. They are not really engaging the varied stakeholders, and where the real wealth is, staying underneath. And when we could actually consult with diverse stakeholders, and we could understand what we should do, what we should not do, and especially how these stakeholders can also, come in, and we all can converge together to build up a safe and healthy system around the beach. And that's what we have come up with in Marina Beach. Please, everybody come and visit whenever you have the chance. It is opposite to Vivekananda House, and it is from the service lane of Marina Beach till the waters, and with a very beautiful sea viewing deck. And we also have a container where our assistive support devices are also stored, and you can just access the container at any point of time, and access the beach with your friends and family. And there is no looking back. You can enjoy it as equally as your family members without disabilities do. Thank you.
The floating wheelchair seems super cool.
Thank you so much. Yeah, it was specifically procured by the Greater Chennai Corporation, and it is a bit expensive, but then of course it gives you the equal experience. And so we demanded for it, and the Chennai Corporation was happy to procure it for us.
It's a very nice success story. It makes us feel very happy. And before moving on to Abhishek for the next question, I just wanted to say a random fact I remember about water. Apparently, everybody feels calm near water. It's an evolutionary thing because when you're starving and there is a source of water nearby, you know there is food available. So it kind of like calms down your nervous system that way. I do not know whether this is true or just some random tidbit I read, but moving on to Abhishek. Um, so my question again to you is about sexual health of people with disabilities. So I want to know what are the attitudes of caregivers and what are the attitudes of health providers about dating and sex lives of people with disabilities?
Well, I think most caregivers are very protective about disabled people. They fear for the safety of disabled people. That's quite natural, actually. In our society, there is a very uh, anyone who is lower in power hierarchy is either seen as someone very vulnerable or someone that needs to be protected. So, in terms of caregivers, definitely there is an attitude towards either desexualization or being very protective, which does more harm than good to disabled people. Because the thing is, even caregiving is a very complicated thing. Um, for example, for many disabled people, the only kind of touch they experience is with their caregivers, and that is a fact because uh, they have to change their clothes, clean their intimate parts. For many of them, that is the fact of life. So to expect, and yet in a very non-sexual way. So a very sexual act so the level of desexualization that takes in their head, you know, of considering anything which is sexual as something unnatural, maybe because and that's reflected in the society's attitude. But the medical practitioners also, I think women across disabled women have always faced this situation where they have gone to a doctor for some checkup, and they have never been asked, are you sexually active, which is the funny, because when young women go to doctors, they are asked, are you sexually active, but disabled people skip the question. And culturally also they skip the question, because I know of disabled women who go to weddings, and in weddings everyone is asking 25-year-olds, are you getting married, when are you getting married? And disabled people will just skip the question when it comes to disabled people, because it's taken for granted that it's either will be a burden or they would be matched through a system that has been created alternatively by patriarchy, where they are matched with someone with either a lower social class or someone with a similar disability. So that happens a lot. I think sexuality is anyways not considered a priority, you know, for not neither the caregivers nor the doctors. It's the attitude is that you are alive. What more do you want? And that is the attitude of society also. Now, okay, what more do you want? Why do you want to even have sex? Why do you want to even go out? Why do you want to do anything? You are alive. You should be grateful that you are alive. And it's almost as if to say that we are letting you live, and that should be enough. And that is because able-bodied people, also the medical system, everyone knows that they are also participant in this entire, normal slash not normal dichotomy which has been created. They are participant in it. With a lot of disabled people, they have never been taken seriously about anything like PCOD. I'm sure a lot of women come to you and say that they are not taken. And when it comes to the persons with disabilities, first of all, if they are fat, then again, every solution to everything is lose some weight. And with men also, it's lose some weight, everything will be all right. But when it comes to especially sexual health related stuff, it's always either lose your weight, or if you're disabled, then you basically don't uh, deserve that kind of attention. You are not taken seriously. A lot of people with invisible disabilities are never taken seriously because they are not supposed to be taken seriously. People there is a history of women being called that they have paranoia, or uh, that there is a history of that, them being diagnosed with paranoia whenever they complain about things, or um, so the misdiagnosis, not only it's mixed diagnosed, it's also creates a system where there is nowhere where to go for disabled women and men. With men it's better because they have patriarchy to save them. If they are heteronormative, they have patriarchy to save them, because then they can just hide behind being a man, being a that like I work, I earn 30,000 rupees, I have a house on my of my own, I can get married, or my dick works, which is, sorry to say, I'm hoping everyone is an adult here, but yeah, that is one of the biggest flex, because I think because that is a symbolic thing for, I am part of patriarchy. I might be able to reproduce. So all of these things there are there. With women, it's very different, because with women it's always suspicion, because even if they reproduce, it's always considered a burden. And how will they, generations of people to be caregiven, and that's how people, often disability, anyone who is associated with disabled bodies is considered someone to be caregiven. And as soon as the whole caregiven thing comes up, because there is no state in caregiving, it becomes completely individual. So um, the most of the activists, in fact, many of the activists whom I come across in Delhi and Mumbai and other places, have very progressive parents, of course. But and you see them because they are the exceptions. Because I think parents, caregivers, why would they, who would they go do this, put their life on hold and travel with their kids? My parents wouldn't have done that. To be very frank, they wouldn't have done that. So I understand that, and so to acknowledge that they have sexual desires or needs, you know is something beyond their scope. And that is the attitude of the whole, and medical establishment is one thing which we forget, that medical establishment is also part of society. Everyone who is a doctor is also, so there will be some very progressive doctors. I'm sure there are lots of progressive doctors in the group right now. I can see some names who are very good, and there are some who would be very regressive, uh, because they are the same kind of, they have the same kind of stuff which goes on in every Indian family. And they're especially condescending towards disabled people, because they think that everything, see, the whole culture has been anyways up and has been propagated even more by COVID era, because now we are no longer patients, we are people with comorbidities, and that will stick for our life. So whenever we enter a clinic, whenever we enter any, with any problem of ours, any sexual health problem, anything, we are always comorbidly people. I have had experiences of going to a hospital and doctor saying ye to nahi bachega, and I'm saying this is nothing, yaar, I've had this infection before. And but the doctor is so sure that I'm very critical, that he not only forces me to stay in the hospital, very expensive hospital, for 10 more days, he also makes it a point to, he will discharge me when he sees me walking. It was the most bizarre thing. And he was very, like, of course, I'm sure he must have had degrees from nice places. But that is the attitude of doctors also. So and most of disabled people have these experiences with doctors, that they are very condescending. In fact, one of the reasons I stick to my physician for most of my issues is that, because he knows me for 35 years, so at least he won't treat me in a way that every little instance I'm about to die, comorbidity. So the whole comorbid thing is even worse. In fact, the funny thing which happens is, I was in a hospital, I was in AIMS, after the Delta wave, ICU and all. And so the doctor, the assistants would come up, probably the MD, the master students, they would come up and they would do the whole thing. And So one day the doctor comes and says to the main doctor that he has diabetes. I said, no, I don't have diabetes. You check my charts. But because I was fat, okay, and in fact, the person who was thin beside me had diabetes, and I didn't have diabetes. So I know I don't have diabetes. So, but it's just in your head. There's so much shit in your head that you have to keep. And you often, after a point in time, you take a very, it becomes very, it becomes a funny thing because most of the I think people get in. I don't think disabled people can take doctors very seriously, to be frank, because if we start taking any kind of disability, if we start taking doctors very seriously, then we'll have multiple parents in our lives. We have our parents, and then guardians, then doctor who is acting as guardians, and everyone trying to reinforce the best way of for us to live our lives. And that is a huge problem because in disabled people are losing agency over a lot of these things. And so the main thing is agency. And do people do disabled people have agency over their bodies? No. Do disabled people have agency over their desires? Very little. Do disabled people have the agency over sexual expression? Very limited. So when all of these three things are very limited, what happens is whenever if people try to acquire those agencies, they are just considered, it is even more abnormal for society. The whole thing was, I saw a comment on someone's reel, queer and disabled, तो मतलब जैसे दो अवगुण मिल गए हैं, ठीक है, it's like that. क्योंकि people see कि मतलब एक तो तुम disabled ऊपर से queer भी हो, as if they are, because everyone is interested in everyone's sexual life anyways in India, because no, even if no one really cares, everyone has curiosity about who is doing what. And yet they are very regressive. They are very like, Arey, how can she get pregnant? How she get? A lot of disabled women want to reproduce. And this is a very controversial point which I want to end on. Not controversial, actually a very simple point. A lot of disabled women want to have kids. I can't imagine the society having a discourse about single disabled women even adopting a kid. They want to be mothers. In the law there is no provision, but even any kind of discourse, I see it very difficult, because it's such, the idea is hostile for makes people hostile, and that is a very simple reason that any disabled woman, and motherhood is very purified form of the whole sex business. Motherhood hai, it's not sex, motherhood. So even if motherhood is not suitable for disabled women, then sex to chhodi do. Disabled women on the other hand have, like, they have very good sexual lives, some of them. There's a difference also, like, let me clarify one very big thing, that a lot of disabled sexuality is also about bodies. It is a very body related thing. So a lot of bodies matter a lot, and a lot of bodies, if bodies allow you to have good sex, if regular sex without any problem, it should not be a huge matter for the society. But even then, because the forces are it's so judgmental, the eye of anyone having sex is so judgmental, is that it's very difficult for them to express themselves freely. But that's another story. But overall, it's the whole DSX, it's a boring old discourse, the whole desexualization thing. It was used because what happened is, because a lot of intellectually disabled people, it was a way to villainize disabled people, and they often chose a lot of men with intellectual disabilities, men with whom they could visually prove that they are not capable enough for having that autonomy. And the government also, the law also doesn't give them much autonomy when it comes to mental illness, when it comes to intellectual disabilities, that there's no autonomy as such. Even certifications have to be renewed every 1.5 years or 2 years or something like that. So yeah, it's basically that same attitude all across everything.
Thank you so much for bringing up the various nuances of sexuality being autonomy, being doctors not taking people seriously, which I agree. I feel like a lot of doctors really need to go through the system to actually understand what it's like. I have PCOS. I was about 10 kgs heavier. The thing my gynecologist said then was the same thing she told me after I lost 10 kgs. Ki lose more weight. And then I was like, ki kaha se? And then I had to take my husband like with me so that they would take me more seriously. And then when they said lose more weight, he shouted at them saying, kaha se karegi? Abhi she has lost weight. You have to really think of something else, to explain her symptoms. Like, please don't say lose more weight. If they can reduce an insider, if you could say a healthcare professional who is an insider 2 tiers, by putting them through the system, I can totally see how like the system is really, really bad. Doctors should really get some perspective. So before moving on to the next question that I would like to ask Smita, I'm just putting a link in the chat box. So that has all the work that all our three panelists have done. It's got link to their publications, their videos, their music, and also articles that have been written about them. So I'll just put that in the chat box. Please do go through it and engage with their work. It's brilliant. And so moving on, now I'd like to ask Smita about policy, like the existing policy that awards access to people with disabilities. Does that have provisions for places of leisure, or what things need to be added or changed or better implemented?
Yeah, yes. So it has a provision, good provision on accessibility. Section 40 to 46 talks about accessibility of not only physical spaces or the built environment. It is also talking about accessibility on or demanding and providing accessibility for in information and communication and technologies and facilities and services also. The consumer products. So everything across board should be made accessible for persons with disabilities, all persons with disabilities. That is what the Act is mandating. And the Act is also talking about time frames on accessibility, like the services should be made accessible within 2 years from the formulation of the rules, and the physical infrastructure should be made accessible within 5 years from the rules, and which deadline has also long gone, long passed by. And but still, there is a small progress now, as the Act is also talking about formulation of guidelines, specific accessibility rules for specific services, which has been worked out by certain departments, and which was not really inclusive of persons with disabilities or the consultation or whatever. And now the Supreme Court has given a ruling in the Rajiv Raturi case saying that every service and every infrastructure should be made accessible, and which needs to have an accessibility guideline, so which in consultation with the civil society. So the civil society is engaged right now, and the disability department is also facilitating it, and we are part of the discussions, and we are in the process of coming up with these guidelines. And when people are engaged, what is the difference is we are looking at accessibility as a priority, as a non-negotiable, and how to look at how it can be associated with the aspects of or with the rights of dignity. how the aspects of equality and dignity can be broken down into tangible measures, tangible means, so that every service adheres to that specific aspect, and it ensures dignity and equality for everyone, not only persons with disabilities. So these are the aspects that that are a development from the Supreme Court verdict. And with regard to the leisure on accessibility, the act is talking very strongly about different things. For example, it is talking about facilitating and supporting and sponsoring the artists and writers with disabilities. And it is talking about creating a disability museum where different aspects of the disability movement, or the different experiences of persons with disabilities, or the assistive aids, and whatever milestones happened so far in the disability movement, everything can be put into the disability museum. And we have a museum of possibilities in Chennai, where we have a display of assistive aids and adaptations on a day-to-day basis, which can be used not only by persons with disabilities but by everyone. Say, for example, we have the mixer grinder or the washing machine, or even a stove, which is an accessible unit used by everyone, right? So accessibility is required for everyone and not only for persons with disabilities. And when the administration and the society get involved into researching and developing the equipments, accessible equipments, then it will enhance accessibility for everyone, and it will be usable for everyone. So that is the aspect that we would like to bring across to the world, that don't look at accessibility as a separate thing which is needed for one particular group of people. It is needed for everyone, and you are using it day in and day out. So, and yeah, coming back to the act is also talking about promoting recreational centers and other associated activities. And it is also talking about facilitating participation of persons with disabilities in diverse activities such as scouting, dancing, art classes, cultural subjects, and everything. And redesigning the courses. Right now it's not accessible for persons with disabilities, so you redesign the courses on arts, and develop technology, develop assistive devices and equipments, so that people with disabilities can be included meaningfully in all these activities. And specifically, you look at the television programs, they are not accessible, so especially for people with hearing impairment. So how to make the television programs and or the cinemas, the movies accessible for people with visual impairment or people with hearing impairment. And act is also talking about in detail about sporting activities for persons with disabilities, what could be the diverse facilities that can be made available, and how redesigning can be done in the sports area. And one full section is talking about it in section 30. So the act is talking about multiple things. It is not just talking about making things accessible or making the leisure spots or cultural centers accessible, but it is also talking about the information. How to make the information available for people with disabilities, because if some facility is available and if the information is not reaching people, then people won't know. So the information to be made available, and the information to be made available in accessible formats. Then third is about facilitating people. It is not enough if you make things accessible, if you give information. You need to brainstorm, you need to ensure that people with disabilities are part of it. So make different facilitation measures towards this inclusion process, and towards that redesign the whole thing. Wherever it is not accessible, redesign it so that it is providing accessibility at every point. So these are the different things that act is talking about. And when Abhishek was talking about the SRHR services not accessible, see, for example, the contraceptives, the pills are not accessible, any pills for that matter. If a person with visual impairment, if a woman with visual impairment have to take a contraceptive, and she won't know what tablet is it, when somebody gives it, in her hand. So what is required, you can have a QR code about which will give all the details about the tablet, so that she can just scan it and she will understand, okay, this is what is given to me and I can take it safely. So the information is very, very crucial. Without information, I am left at the mercy of others, even my caregivers, and at many times I would like to do certain things which I don't even want my caregiver to know. I want my own agency, I want my own decisions. And so in those spaces, in accessible information is very critical. And the staff, where the SRHR services are provided, when a person with disability, when a woman with disability goes and asks for the services, and there is a kind of an abuse happening by the staff. Why do you need SRHR services? Why are you coming and asking? Already we are overburdened with work. Why are you burdening me more? So this is an ableistic attitude, and this is a kind of an attitude, like Abhishek said, people with disabilities are considered asexual, and when we are ascertaining our rights on an equal basis with others, that is, because of the social stigma, people are not really able to understand it and serve properly. All we need is just accessible information and sensitized services. And because of these issues, we also see many women with disability undergoing hysterectomy when they had to get admitted into residential institutions. What the perception is like, we have to take care of your menstrual hygiene, and which will not be possible for us. And so they need to look at accessible services there. Instead, what they are going to is that they just want to have an easy way out by affecting a person's body and a person's health without even the informed consent of the person. And these are really unsafe and dangerous aspects, which should be replaced by a safe and accessible measure. So these are the circumstances which makes us understand about the requirement and the importance of accessibility. So when a service is accessible, it becomes safe, it becomes informed, and I have my equal space. When it is not accessible, I have to undergo all these dangerous situations. So accessibility is the cornerstone of safety and equality.
Thank you so much for that. The information asymmetry part, it really hit me because when I need to know about something and I don't want to tell anybody, I can listen to a podcast, I can look up the information on the internet, and not making information accessible is not allowing people to help themselves as well. Like you are not helping them, but you're not allowing them to help themselves by empowering them with information. That is such an important point to bring up. What I'm learning from here is that any measure that focuses on accessibility should keep the principles of dignity and agency and privacy and empowerment and all these things as guidelines with which it should be made, right?
Absolutely, absolutely.
Thank you. Thank you so much for that perspective. It was really enlightening for me. So the last question would go to Abhishek. And it's just a question on, have you seen any success stories of countries or places which have done sexual health right for people with disabilities? If so, what does that look like?
Yeah, I don't think So for most of the countries where people have welfare, okay. So the main thing is in India we don't have any welfare system which supports disabled people financially. So they have no autonomous. They don't have the agency again to take those decisions of what they want to do in terms of sexually expressing themselves. Where in every country has an uh, sexual and reproductive health component within their disability plans also. So that is taken care of, which is never even considered in India. And the other thing is like, for example, Amsterdam, there is a money given not specifically for sex related things, but it's assumed that the government is giving you the option that you can use it for uh, using for sexual therapy or any kind of, or for buying sex basically. And so that is a very progressive law. In fact, there's so many films in the Western world based on just the idea of a disabled person, a person on wheelchair, going in search and looking for sex. India में भी बनी है अब. There is a Karnataka film which is about that. But the thing is, which is problematic in India is that there is no even the law. There is no mention of sex. Even there is hardly any mention of sex. This whole whenever sexual right comes up, it comes up in either as LGBTQ or in terms of some medical thing like AIDS. It comes as some disease prevention thing, and so it is never. What is missing across the world is the idea of pleasure.
Mm.
But socially, pleasure, the idea that disabled people are seeking pleasure, might be seeking pleasure, is accepted much more in the Western world, in where there have been much more advancements of disability rights. The whole UNCRPD is inspired by American ADA, and UNCRPD is the inspiration for our own RPD, watered down version of RPD, UNCRPD. So in that sense, a lot of things which happened in the Western world, and now Europe is taking over. Europe is doing much more progressive, making much more progressive laws for the disabled than even America. So yeah, a lot of these things are taken care of. At least they're understood that that idea that disabled people have sexual lives and have desires and uh, might pursue those desires is much more acceptable in the Western world than in our country, of course. And in our country, anyways, as we said before, we don't talk about sex at all. So even if we talk about sex, it's about, as I said in the when we last met, the whole sexual and reproductive health is a huge. I think there is an excuse for that. It's called sexual and reproductive health because sexual part is generally pushed aside, and we
Mm.
mainly talk about reproductive health. And sexual health comes only when it's about normative aspects of sexuality. But we need to put sex in the at the center of sexuality, and that is
Mm.
something which is essential if we want to even take forward. And we are long way from going that distance. But yeah, why not? This conversation is a starter, maybe.
Ah. And the way you mentioned that sexuality is discussed only in the non-heteronormative context, but in India, in the queer context, sexuality or sex is discussed in a very disease model of like,
Yeah,
sexually
everything
transmitted.
as for a long time it was just about AIDS, and
Mm.
now also it's mostly about AIDS. So and or it's about some operation or procedure, or it's
Mm.
very socially, it's the understanding, and that hurts a lot of queer people, trans people also, because if you are seen only as a medical procedure, if you are only reduced to a medical problem, actually. The way the medicine sees it sees it as a medical problem. It sees dysphoria as a medical problem. It sees any form of uh, gender non-normativeness as a medical problem. It sees disability also as a non-normative problem. So in that sense, a lot of us are seen basically as a problem that needs to be solved. For the first time, a doctor sees a disabled person, the first thing is, can they be fixed? And if they can't be fixed, then how can we contain? So the whole medical terminology is like that only. It's treatment, containment, and around these things, we have a system built around, the medical system is built around that idea, and it applies to disabled people and queer people. And like the government reduces us to beneficiaries, the medical system wants to reduce us to patients. And that is one of the biggest problems with the way medicine is, medical professionals, not all of them but many of them approach uh, every person who comes to them as merely patients and not anything else. They are patients, but they are human beings also. So yeah, that is one of the steps forward.
So we have about 9 minutes left. We can take 5 more minutes as well. But if anybody has any questions, please put it in the chat box, and then also which of the speakers you would like to address the question to. Then I will just flag that. This other thing that, like what Abhishek was saying about people being treated as problems, right? I was talking to one of my trans friends, and we were talking about why trans people do not really like accessing vaccines, or why they have so much hesitancy. And that person was saying this medical language kind of sees them as a bridging population, like they say men who have sex with men, or MSM, which is the term they use, or transgender people, they want to vaccinate them or care about their healthcare because they're worried that they will pass on some disease to the hetero people, heterosexual, no, whatever they define as the mainstream general society. And so the term they use is bridging population to refer to these queer individuals, right? And my friend was saying, like, if you don't care about me, you really don't care about me, you care whether I will give this disease to people who you think are normal and who are well integrated into the society. So how will I trust the system if you approach me with this lens? So I was like, yeah, and the way you said they think about queerness and disability as a problem to be solved or to be contained, rather than a variation of normal that needs to be celebrated. Ashish Gupta says, wanted to read more on these issues. Please recommend internet resources, if any. Of course, I have given the work of all our panelists. But other than that, is there any resources that the panelists would like to suggest?
Tarshi would have some pieces on queerness and sexuality and disability and sexuality and things like that. Tarshi is it's a website, and there are other resources which you will find. But the whole medical field of medical humanities, you have to actually dive in and see if there are doctors who have written about it. There is some work. I don't know if there are articles about it, but there's work going on uh, with respect to LGBTQI people and medical humanities, done by Aksha Sheikh and Dr. Satendra Singh and people like that, Dr. Aksha and Aksa and so you have to check them out, their work out. Dr. Aksa is on Instagram and all on social media. So these are the people who work. Yeah, Tashi is the website. You have Tashi publishes a lot of stuff on sexual uh, health and sexuality. So yeah, definitely check that out. Uh, and yeah, uh, I think it's a growing discourse. And yeah, but to check these people out, they are doing work around it, and there's very little work around medical humanities and queerness and disability, but definitely their work has been initiated. So, and if as doctors, if you are interested in it, that would be great if you can be, express your interest or be part of it. And anyone can should be interested in it. Yeah.
Abhishek, there's a question for you. They said about non people with disability bodies, non person with disabilities have bias against people with disability bodies. How can we correct that bias?
Um, I don't think it's our responsibility to correct that bias. And it's not like we can't do much, because if you don't really empathize with disabled people, you haven't met a disabled. Many people haven't met a disabled person. They don't know. The only references they have to disabled people is Langra Lula kind of language, or they have seen somewhere Raina show crack a joke about disability, or some disabled person who is self-deprecating and taking it easy, and being playful, because a lot of disabled people put out a very brave face, because there's no other way. If they actually stand up for be the abuser would be hurled at them, they would be treated harassed instantly. But yeah, one way just to talk about lives, I don't think I think a lot of things about disabled life are not very peculiar to disabled life. Apart from the disabled bodily experiences or the psychosocial experiences themselves, there are also a lot of common things. A lot of people enjoy music. Lots of people enjoy watching films, or doing art, or doing painting, or doing whatever. So there are lots of meeting grounds. It's just that the if you are hostile to the idea of, if you always are thinking about the body in terms of difference and how it shapes you, then you won't have that conversation, because and it's not a disabled person's responsibility to actually uh, start that conversation. So yeah, I think able-bodied people can have that conversation, and we often, I think, every person would go around and say, "Ki, you can ask us what you want to, do. You want to help us, first ask us. You want to talk to us, just talk to us. Everyone is ready to talk to you, able-bodied people. So the ball is in the court of able-bodied people, for sure.
Um, yeah, so thank you so much, everybody, for coming here, the audience, and of course, the brilliant panelists. Like, I personally feel like I have conducted three forum discussions, and this one was the best and the most fulfilling for me to work on. And Smita had said something really nice when back when we had met her first, and that was that people do not realize that anybody can become disabled, and that is the thing, right? Like even people without disabilities right now has built a world which will not support them tomorrow if something happened to them, right? Like, and that makes no sense to me. Like I mean, this is lack of self preservation if anything.
Absolutely, absolutely. Yeah. I just want to mention this, like Abhishek and Pratiksha also mentioned the how to break the bias. We need to bring more familiarity. And yes, please talk to us. We are ready to talk to you. And also, community support programs. If we can build on that, for example, what we are doing at Vidyasagar Chennai, we are trying to create community support circles, the support system around a person, like build up friendship. So how can we build up friendship? Go to a park, and meet people whoever are coming there, and even people may hesitate to talk to you. So what we do is we purposely plant a tree and talk about that tree to others, so then there is an opportunity that people can engage, and with on the base of the tree, then we are developing conversations, and we can go into much intense and deeper conversations like this. And that gives a perspective, that changes the perspective of people also, and understand, they tend to understand that okay, there is no much difference, and we are all on the same page, everybody talks the same thing, and everybody can contribute. And even if there is difference, yes, there is difference, but difference is there everywhere, and the difference is part of human diversity, and disability is part of human diversity. So that is the crux which CRPD is also talking about, which came up very well with Pratiksha and Abhishek's comments also. Thank you very much for this opportunity.
One last question. I'm so sorry. I want to hear you speaking, but uh, Abhishek said that sexual and reproductive health is not mentioned anywhere in law, right? Like, because you reviewed the policy, I just wanted to see whether it's there in that act in any form. Access to.
Yeah, there is specific section on the SRHR services itself, sexual and reproductive health, and also any abuse and violence, that is also been mentioned in detail. Whereas that simple mentioning is not enough. So what we want to develop on that base is a huge amount of awareness and a huge amount of accessibility measures towards its SRHR services and SRHR conversations, sexual and reproductive health conversations, so that people know, that people also get information, and they can also be safe, and they can ensure their dignity. A right to inherent dignity is everybody's right, and one's autonomy is everybody's right. So that will be ensured only when these are discussed, these are elaborated, and more accessible services are developed.
It's a very effective approach to SRHR. It's a very, it sees a paternalistic approach to SR disabled people. It sees disabled people as possible victims, and or as service seekers. So there is neither there is, again, the point is, again, there is no sexuality in it. There's no recognition that disabled people are sexual beings and they have sexual rights, and they should have the idea of sexual citizenship, which, even if it's not mentioned anywhere, should be a universal right, in some form. The recognition of someone as a sexual being, if they want to recognize as a sexual person. So that's
Thank you so much, everybody, for joining in. And on a Friday evening, I hope that this starts a lot of conversations. And then I hope some of you will work with our panelists and as well as on this topic. And I also hope that we inspired a few narrative shifts today. So this will become a video which will go on YouTube, and hopefully we will all write something up together based on the conversations that we had here. And yeah, thank you. Thank you so much. I'm very happy that we got to have this conversation. Goodbye, everyone.
Thank you, Christianis. Thank you, my co-panelists. Thank you very much.
you. Bye.
Bye.